All right, so what is Bandage Dentistry? What are we talking about? Okay, so I've had patients that come to my office that have been to other dental offices in the past, and they've had multiple work done on the same tooth or teeth several times over. And they want to save the tooth, and I'm all for saving the tooth, but you have to consider when it's done right the first time, you're not going to have as much issues with that tooth or teeth for the long term. And whatever we do in the office as dentists, we want it to last. Okay. Sometimes this is dictated by dental insurance, because as we all know, with dental insurance, they do cover some things versus not other things, or they always downgrade things. So this puts some patients or even dentists in a bind, because we do want to help the patient, but at the same time, we want to put something in the patient's mouth that's going to last a long time.
You always want to choose the best long-term solution. Insurance will try to dictate, and finances will try to dictate what is best for your mouth. But when you've already had multiple fillings done on one tooth, think of it as a blanket, a quilted like patchwork blanket. You're having a bunch of pieces put together. Over time, they stain, and every time you drill on a tooth, that tooth becomes more and more compromised. So if you've already had one or two fillings done on a tooth due to it being maybe you cracked it, that you had a fall at some point, it chipped, or you've just gotten decay in between the teeth, so you have fillings on both sides, that tooth does become compromised, and at some point you're going to have to get a crown put on it. Yes, crowns are a little bit more expensive, but they will definitely last you a lot longer and look more appealing in the long run.
Yes. So also, if you're a clencher, you've had these large crowns done. I've had patients that have had fillings done on the same tooth about 4 or 5 times, and they're very large. Usually there's very little tooth structure remaining. Any little thing you bite on, usually what happens is when a patient comes to my office, they tell me they were just eating something very soft. They were eating salad, or, they were having soup, and then they're biting down on something just very soft, and the tooth breaks. Now, granted, it's probably not what they were eating at that time, but it was just from the years of constant wear on that tooth, because it's weaker, that the restoration just ended up breaking as a result. So you want to consider that as one of the things that when you decide what you want to do, especially with dentists, I advise dentists, to make sure that when you do something for your patient, always consider that if this was your mouth, what would you do? Would you do something long term? Finances should not dictate, in my opinion, what the best solution should be for the patients. I know that is a reality though, but I try to always focus on what is the right thing to do and what's the best long-term solution for that patient. Okay, let's move on to other things. So number 2, we're talking about root canals. So we also have patients that come to our office that have had root canals done. And as we know, once a root canal is done, it is a very good option for patients, because you get to save the tooth and it's long lasting for a lot of patients. But we also have some drawbacks. Erica, would you like to expand on that?
Yes. So when you've had a root canal done on a tooth, it usually started because you either had a very deep cavity or the tooth broke at some time and there was nerve involvement. And the only way to keep that tooth is to do the root canal. So once the root canal is done, if for any reason somewhere down the line it starts to get reinfected, maybe you never had the crown that was supposed to go on top of it put on, which happens a lot in this field. Sometimes you'll just do a filling and never get that permanent crown put on. Those fillings again can start to leak, and you can get basically a reinfection of that root canal. At that point, if the tooth is still good and it still has good solid bone around it, my doctor likes it's still a good, especially if you're super young, he's going to recommend that you go ahead and go to the endodontic specialist and get the retreatment done so we can keep the tooth. Now, sometimes there's a chance that we may not be able to save the tooth. It may have a vertical fracture in the root or something, and we may have to explore a different option. But again, that's what the root canal specialists are for. They will take a look at that tooth and tell you what your best option is, whether it's worth saving or not.
Exactly. And one thing is to consider is when a root canal is done on a tooth, the tooth is basically a dead tooth. It is definitely more fragile, so it's never going to be as strong as your other natural teeth. Even when you put a crown put on it, it definitely can last you many years. But oftentimes, you can run into the chance of, long-term, especially having a break. And sometimes root canals, you either yourself know this or someone that has had a root canal done. Root canals can get reinfected So that is another thing to consider with root canals. Sometimes if the infection that recurs in the tooth is small, it can be easily retreated, and then another root canal is done, and then the tooth can be saved, and oftentimes it can't be. So those are things to consider. It's like how much investment do you want to put in that tooth for a long-term solution.
You also want to always take into consideration that these are your teeth. This is something that is super important to you, and hopefully most of you want to keep your teeth. I know that a lot of people think that, oh, if something's wrong with it, let's just pull it. But once that tooth is gone, there's no getting it back, okay? So if you're more interested in being a patient of ours and you would like to come in for a full comprehensive exam and a cleaning, then give us a call at 469-625-0005 or click the link below and somebody will get in contact with you to schedule that appointment.
All right, so as you mentioned, let's talk about cleanings. So we also have patients that come to our office that want to, let's say they haven't gone to a dentist for a long time. Their gums are inflamed. Their gums are bleeding, and they come in and they, they have dental insurance and they're like, I want to do just what my dental insurance covers. Or due to finances, they're like, okay, I just want to get a basic cleaning. In our office, we take x-rays. My hygienist checks the gums, checks the bone level to see the health of the gums. And why is it important, Erica, if you are a patient who does have gum disease, you do have bone loss around your gums, you haven't been flossing regularly, why is it a good idea to have a proper cleaning done versus just having a superficial prophy done?
Okay, so the best analogy I can give you is think about when you're walking out on a pier, which I think at some point in time most of us have, and you look down at the stilts that the pier is on and you see all those little barnacles that are attached to the pier. Well, basically, if you haven't been to the dentist in years and now you've got this new job, you're like, I'm going to do things right, I'm going to get my insurance and I'm going to go to the dentist, I'm going to use it. Yes, we do want you to do that, but you also have to keep in mind that when you haven't had a cleaning done in that long, we have salivary glands in our mouth, we have good and bad bacteria that produces in our mouth, and we get these little deposits around our teeth. We brush our teeth, yes, but there's also other sides to the teeth in between. So if you're honestly not flossing on a daily, which most people don't, and that's okay, if you're not water picking, it's a lot harder to get those deposits out from under there, and that's what the dental hygienist is for. When you come in for a comprehensive exam, we're going to take measurements of your gums. We're going to check for those pockets. We can usually see the buildup on the x-rays, and that will dictate what type of cleaning you are. And just keep in mind, yes, we always want to get to the point where you're going to be able to have your free cleanings. It just may not start off that way, okay? There is coverage on the deep cleaning as well. With your insurance, it's just not always covered at 100%. So just keep in mind that the insurance is there to help you financially, but it's not there to specify what type of cleaning you are. It's really up to your dental hygienist and your doctor.
At the end of the day, we want to do the right thing and make sure that we treat all our patients properly and ethically. So we want to make sure that we take care of the issues that you're having to for us to be able to do that. We got to take the right x-rays, we got to do the proper measurements and get the proper cleaning done. Because my goal personally is to make sure that you stay healthy and you get to keep your teeth for the rest of your life.
Yes,
Okay.
because nobody likes bad breath or bleeding gums, right?
All right, awesome. So let's talk about the last number 4, Bandage Dentistry for teeth that need to be either extracted or what to do in replacement of teeth that are being extracted.
So when you come into an office and let's just say you're in a lot of pain and you basically at that time all you can think of is I just want the tooth out. Yes, sometimes that is the scenario. Sometimes the teeth, if you've let them go so far and you just haven't been to the dentist and you only come to us when it hurts, it kind of sometimes makes us seem like the bad guy, but we are not the bad guy. We are there to help you, okay? If the tooth is not savable, the doctor will say, yes, let's go ahead and take the tooth out. Now, what we want you to consider is replacing the tooth. Most of the time, what a lot of people don't know is that teeth are usually married, okay? They have a spouse on the other end, and teeth have to have something to hit up against to hold them into place. Once you start losing teeth, your teeth will start shifting, everything starts changing, you start having migraines, you all might have clicking of the jaw. There's just so much that goes into it if you don't replace the teeth. So with that being said, Dr. K is going to elaborate a little bit more on when you get the extraction done, why a bone graft is needed, and what type of replacements are out there for you.
I also want to talk about another analogy. You talked about the marriage. I'm going to talk about a car. So you just bought a brand new car and you're driving it, you got new tires on it. Imagine you run over a nail and the tire deflates, and what do you think happens to the other three tires? They're going to work extra hard. Same thing happens in the mouth. So if a tooth is needed to be extracted, removed for whatever reason, what happens is if you just remove that and do nothing, the other teeth are going to have to work harder to kind of take over the job of that one tooth that is no longer there. And what happens, as she mentioned, teeth do shift, bite changes, bite forces are going to be put on places where the other teeth cannot handle. So over time, you're going to have more wear, more chipping, and more issues with that. So, in areas where we want to replace teeth, now I'm not talking about wisdom teeth, but sometimes you have a tooth either in the front or, in the premolar area where you have a tooth that's extracted. We want to definitely be able to maintain the level of bone once a tooth is removed. There are a lot of biological changes that takes place when a tooth is removed, and one of them is bone remodeling. So you lose a lot of bone in some cases when a tooth is removed, and depending on if the tooth was infected or how the tooth was removed. Was it, there's no such thing as atraumatic extraction, all that that is sometimes used in dentistry, because it is still something that is being taken out of your body. But there's a proper technique in how to take out teeth and not. But main thing is, when you have a tooth removed, you want to make sure the volume of bone stays at a good level, because in order to replace it, for example, whether you want to do a dental bridge in the future or you want to do a dental implant, that will dictate how successful that restoration will be, because we just don't want to put dental implant in your mouth. We want to be able to restore that with a crown. And we need good bone level, we need good tissue, protecting that implant inside the jaw. So those are considerations you have to take into account. So bone grafting is, it is very important to have done once you have a tooth removed in our office.
So next time you go to the dentist and you're having some pain and you're thinking about getting that tooth removed, just also remember to think about the future implant placement or whatever you're going to do to replace that tooth, whether it's with a bridge, whether it's with a partial. Just keep all of those key factors in mind. Don't think of just taking the tooth out and leaving it that way. It will lead to a multitude of different issues that can happen.
Awesome. I hope this video was informative and you learned some new things, and hopefully avoid the headache of Bandage Dentistry. Please give us a call at 469-625-0005. For more information about our office, we'll be happy to help you.